Hi, I'm Patricia Greenberg, the Fitness Gourmet. Welcome to Eat Well, Live Well, Age Well, a new series about all things aging well, delving into topics that are important to all of us as we age. Today, I want to introduce Hadas Abouaf. She's a registered nurse and founder of Med Divide Nursing. It's a company that provides qualified nurses to sort out and organize medications and information for at-home patients. And I'm so happy to have Hadas here today. This is just a topic that's very near and dear to me with my family members I've had to care for because we know the consequences of mixed medications and the wrong combination can be really dire. So Hadas, welcome to the show. And please tell us about your background and how you got started in this service.
First of all, thank you so much for having me, Patricia. Lovely to see you. I started my career as a registered nurse 25 years ago. I worked at Children's Hospital, Los Angeles for about 7 years. I worked with very acute care patients who were awaiting or just have had transplants, hearts, livers, lungs, and kidneys.
Wow.
And I got a very good background in gastrointestinal stuff and in dialysis and things like that while I was working in the hospital. And then when my first child was due, I started a home care company with my family, with my parents and my husband, where we took care of clients who are elderly, who needed some help in home with some activities of daily living, including transportation and cooking and just companionship, bathing assistance, things like that.
Okay.
And while we had the company, we had that for 12 years before I sold it. But what happened was I saw a lot of our clients who were very confused about their medications. And according to the Department of Social Services, caregivers are not allowed to organize and divide up medications for clients.
Really? Oh, that's very interesting.
Legally, they're not allowed to. Only licensed people are allowed to divide up medications. That would be doctors, pharmacists, registered nurses, and then also family members are okay. But home care providers who are not licensed are not allowed to organize medications for clients.
That's a very sticky subject, I'd imagine, because more often than not, families are leaving their person alone with a home
Yes.
healthcare worker because they're working or whatever the need may be. Oh, that's very
And the
scary.
regulation only started just a few years ago when the Department of Social Services started overseeing home care companies. That only started in around 2016, 2014 to 2016. And so up until then, caregivers were fine to organize medications, and now they're not. And what I saw that caregivers were organizing and dividing medications for their clients, and they had no idea what they were doing, nor did anybody else have any idea what was happening in the home. Doctors didn't know what the clients were actually taking. Clients were confused and taking over-the-counter medications. Family members saw their parents as not being, as going downhill and not having any control and not being sure if their family members were actually taking the medications as prescribed. And so for our clients in the home care company, I started organizing their medications, mainly because I didn't want my caregivers to do it for them, because it was a regulated service now. And I found that I really enjoyed doing that. I enjoyed teaching. I enjoyed sharing with people. I enjoyed getting in touch with physicians and sharing with them what their patients were taking and figuring out together as a team how to make this client feel best, how to optimize their health.
Yeah, and that was kind of what I was going to be asking you anyway, is how do you manage the caretakers? So I guess the thing is now that they're no longer in your employ, but when you go in, you have to engage the whole family. You have to engage the
The whole
caretakers, the
team.
family. Yeah.
Mm-hmm. I see it very much as a team effort. So it's not just between me and the client at all. It is the caregiver, the family members, doctors, pharmacists, everybody is involved, because it's not within my scope of practice as a registered nurse to begin medications or to discontinue medications. I have to go by the orders of the physician.
Okay.
So by sharing everything with everyone, we're all on the same page. Often clients have more than one prescribing doctor, and they also include some over-the-counter medications and some herbals and supplements, which are not regulated by the FDA. And just because they may be natural doesn't mean that they're safe.
Right.
And
Right.
nobody has any idea what the medications are or what their effects are on the client. The client usually, when I begin or before I begin, doesn't feel well, looks as though they need some help with balance or with just overall health. And those are my favorites.
Yeah.
My favorites are the clients who have a lot of unknowns, and we break it down together, and we let the team know, and then from there we proceed to make the changes that are necessary, and clients often feel better so quickly. It's beautiful to see, and that's one of my favorite parts of working with clients in their homes.
My next question is kind of two-part. So A is, do you see the patients proactively through caretakers and referrals, or is it often an SOS situation where someone's in a dire, they find you after they've at their wits' end and they can't figure out what to do? I guess it's a combination of things,
It's a
but
combination. It's a
yeah. And
combination.
the second half of that is, so do you have conference calls, or how do you pull all the doctors and pharmacists together? Because in this day and age, you can't get a call back from anyone. I'm just wondering logistically how you get everybody on board with that. That's got to be quite a daunting task.
So when I begin with clients, generally I go to their homes. Let me just give you the scenario of
Okay.
how of what happens in the home and how I get the team together. When I begin with a client, it's usually because a family member has called me that they are not around and they're not sure if their parent, loved one is taking the correct medications at the correct time. And they would like for me to check and make sure that they're taking the right medications. Or it could be a care manager or case manager. I work with a lot of care managers who are not allowed to also organize their clients' medications, but they see when they go into the home, they see a mess of medications. And generally, people keep their medications in the kitchen or in the bedroom, in the bathroom, different piles of medications for different times of the day
Yeah.
and different purposes. And so what I do is, so when I go in there, with the client's permission, with the family's permission, with a care manager being invited to the home, I ask for permission to actually go through the home and collect all of the medications. And sometimes it's trash bags full of medications
Right.
that
Wow.
have expired or have been discontinued, that the client is no longer taking. And for some reason, I think it's something that all of us have, is that people want to keep that the last two antibiotics,
Right.
the
Right.
last two antibiotic pills that they have in the little pill box, because they're afraid that if the symptoms start up again, then perhaps they can start the antibiotic and get a head start before the doctor is notified. Or they just in case, people hold on to their medications. But what happens over time is that the efficacy of the medication goes down, and the medications expire, and they become sticky, and
Right.
they become and you don't even know why you have this medication, how long you've had it, and then people start combining medications. I see that a lot too, and I see combinations of colors and shapes and sizes where people have no
No
idea
idea.
no
Hmm.
idea what their medications are. And so we start with those, and we just get rid of those, and we
Okay.
clean up, and we organize. And one of the things that people are afraid of is getting rid of medications. They don't know what to do with them and where to get rid of
Right.
them.
Right. So what
And
is
so
the process for that, is getting rid of medications that is expired or no longer needed?
So fire departments and emergency rooms used to take
Mhm.
medications that are expired and old, and pharmacies used to take medications that are expired and old too, but a lot of them no longer do. There are some collection bins that are placed around town for old and expired medications. So I know exactly where to do that, and I put, you can find them online, although they're not very easy to find.
Okay.
For whatever area that you live in. A lot of CVS pharmacies have disposal bins, but not all of them.
Okay.
And they're for old and expired medications. So that's what I do. When I leave the house, I take the expired and old medications with me. Now, there are also medications that are not expired, and they're okay to keep in the house, but they're no longer in use. So I put those in a separate pile. And then there are the medications that the client is supposed to take, but they're not actually taking, or they're not taking as prescribed. So we kind of figure out what exactly the person is taking. And then from there, I phone the doctors. And generally it's in front of the clients, because I have them sign a HIPAA consent form that I may speak with. It's the privacy form where I can speak with any team member and on their behalf. Some clinicians want me to fax over the forms, and some, as long as the client is next to me, they get permission verbally, and then they begin sharing with me the information. And then we collaborate, and we talk about what the prescriptions are versus what is actually being taken. And it's very eye-opening.
I can imagine. And I want to ask you how we've all had the grandmother that said, I take the pink pill in the morning and the yellow pill at lunch and the blue pill at dinner, and it's in a bowl. Or my daughter had to take something for a brief period of time, and she had all the old bottles sitting in her medicine. I said, why are you keeping the old bottles? She goes, and she's a teenager. She's like, I don't know. And my husband,
in case you need them, of course,
for something
in the future, for some reason, right? Exactly. Of course.
And my husband and I both had, I had a minor surgery. He had an ankle surgery, which was pretty, so they send you home with every pain medication known to man. So there's 3, 4, 5 prescriptions, and there's prescription, it's Advil, but it's a prescription form. And I got a prescription for Tums when I had a surgery. So now there's all these bottles and colors and sizes. So do you just have an eye for it, or you know what to look for? Is there a code on the pill? How do you decipher what it is when you're going into this big bin of it's not labeled?
Of pills that are just free.
Yes.
Free floating.
Yes.
Where are they?
Yes.
Right. Okay. So generally, if they're free floating, they're not medications that people are on currently. They're just medications that are, and some people say, oh yes, I just put it in there. I dumped the pill bottle into this box. And I'm really against that. I like keeping things in their original, pill boxes, the prescription bottles. But if they are currently taking them and it's hard to decipher and recognize, there are programs. I have a program that I use that pharmacists actually use to identify the pills, because every pill has a code. Every pill should be recognizable for what it is. So I am able to input the code and recognize what the pill is.
Okay.
And sometimes it's a lot of detective work. A lot of times.
Yes, I'd imagine.
And so I do recognize what the pills are. And if they are salvageable, I really like making sure that clients are not wasting their money.
Yes.
If a pill is salvageable, and if medications are still okay to take, I will use what they have before we renew prescriptions. And I'm very conscious about using the old before starting with the new. But I'm also very conscious about leaving things in their original prescription bottles, so that we can tell, and the lot number is there in case something is wrong, and for recalls and things like that. I like things as they come for that purpose.
And so you have the medications managed, but I want to know, I don't think we discussed this in the pre-talk at all, but how does somebody get away with that? When I call CVS, I had a prescription and they said, you're taking da-da-da, you shouldn't be taking this they knew right away. So how does somebody manage to procure that much medication in their house?
Because they may have multiple prescribers, multiple pharmacies.
Okay.
They buy over the counter. They take from somebody else. from in the family or whatever they borrow.
Yeah. Okay.
Time has passed, and this person, and now they're using this medication that should have been discontinued and gone. Um, people find ways. I mean, I find years and years worth of supplies in people's homes, and it's really time to clean up. And that's what we
Yeah.
do. I spend as much time as is necessary on the first meeting, just cleaning up and figuring out what the puzzle is. Where are people in their health? How are they feeling? Now, sometimes I get called for consultations. My father just came home from the hospital after suffering a big stroke, a major stroke, and he's been to rehab and now he's home. I want to find out if he's on the right medications. And we start off and I ask lots of questions and we go through, okay, what are you taking right now? And then I speak with the doctor and I get the list from the doctors and whatever. Sometimes I find that clients are feeling good, but there are discrepancies in the list. And in those cases, I say, okay, well, there are discrepancies in the list, and the list is probably wrong. It's probably not you, it's probably the list, because you're feeling fine, you're
Right.
feeling good. So I really go by, what are the clients feeling? Where are they physically, emotionally, mentally? And is there something that is wrong? And often when something is wrong with them in any of those areas, there's something wrong with the pills.
Right.
With the
That's
list of
that's
pills.
very interesting that you can find that out. That's another form of detective work.
Yeah, it
Kind
is
of putting it
detective work. It
together.
really is, and I spend a lot of time with clients. So then, um, on a monthly basis, when I go and refill the bottles, and we haven't gotten to that yet, I also check on the clients and ask questions and see. So that way, their eyeballs at least once a month, or every time I come, to make sure that the client continues to be well and that they're not falling through any cracks.
So, once you have the updated list in place, and how do you determine how much, the person can take and self-manage it? Because I'd imagine there's some people who can't self-manage.
Right.
So there's got to be a point where, you put everything in place and you lose a little sleep when you get home thinking, are they going to be able to manage this or handle this?
So oftentimes when I get called, there are family members or caregivers who are involved in the care also on a daily basis, but not all the time. A lot of times clients are home alone. And so I divide up pills into pill bottles and pill boxes, and for the actual dose that they're supposed to take for the actual time that they're supposed to take it. There are automated pill boxes, which I've used also with clients. And then there are pill boxes that tell you, morning, noon, afternoon, and night, or evening and night. And I divide up the pills to fit the amount or the time that they're supposed to take it. And sometimes they can and sometimes they can't. So I not only deal with clients who are, who've just suffered surgeries or are just, getting older. I deal with dementia, I deal with drug abuse, I deal with people who are just really truly unable to control their medications. And so sometimes I have to lock up their medications with their permission and the care provider's permission. I never do anything without permission. But for the benefit of finding out what exactly the person is taking and getting a baseline of really truly where the person is, sometimes the medications need to be locked up. And so I either get a toolbox or one of those medication lock boxes, and we put away all the medications, and and they only take what I have divided, which is what the prescribed medications are. And this is always with extensive talks with doctors. Now, you were asking about the team, and I have to say I work with clients and their doctors are thrilled to finally know what is happening at home, because most of the time I have never had a client who has been on exactly the right medications that they're supposed to be on, and responsible for taking them exactly at the times that they're supposed to be taking them. There's always been a discrepancy, always. Either they've been over medicated, or they're taking over the counter, or they're supposed to be taking something, but they're taking a different amount than the prescription, or they're taking too many of the same types of medications because they have several prescribers. You know, there are always discrepancies, and so once we've gotten the discrepancies or figured out and resolved, then the doctors know exactly what is going on, and they can prescribe with with some peace of mind that what they're prescribing is actually being taken, and the patient is not being over medicated, and also that we're not treating just side effects, because a lot of medications have side effects, and we pay attention. Now they have boots on the ground,
Yes.
in the client's home, and they have eyes and ears that are educated and are able to really tell if this medication is causing the pain or the imbalance or the nausea or the constipation. And that way they're not treating side effects with more medications and more medications.
Right.
They're changing the medications that need to be changed for the reaction that they want.
You know, Hadas, you're a public service announcement for someone to follow the prescription. You know, it's
Right.
something that I think we're all guilty of, is that the doctor says take as needed. What does that mean? You go
Right.
home and you wait till something hurts, and then it's often too late, especially post-surgically. The idea is to take it prophylactically, so you're not in a huge amount of pain in the middle of the night or whatever it might be. And also listening to everyone around you. Oh, when I had that surgery, I took this, or
Right.
go buy that. So these are the things that, I was going to ask you about, that you have to combat. So one thing that I saw in my own family members, when you have more than one patient in the household,
Mm-hmm.
and they're playing off each other, and maybe not in a healthy way, that they're encouraging each other to take things or to not take things that could potentially be harmful. So combined with the over-the-counter. So again, that's a little twofold question is, so if you have a two-patient household, do you just put them in their stuff in different corners? How do you manage that sort of circus of more than
Well,
one problem going on?
I have organized several couples medications, and we keep their medications very separate. Currently, I have a client who is on a lot of medications, and the doctors, all the prescribers, were going crazy for a long time because they weren't sure what he was actually taking. He was a person who was self-medicating for everything.
Mm-hmm, mm-hmm.
And although a lot of times he was correct in what he was taking, nobody knew exactly what he was taking and when. And there were some serious medications, including heart medications and some antidepressants and some, psychiatric medications that he was taking that you really have to know what the amount is. In addition, he was taking a lot of supplements and herbals. And his wife was also sneaking some medications into him as well, and she's taking a lot of medications. And so I had to have a talk with the wife, and I said, we want him feeling better, but we can't have him he's not going to feel better if he keeps getting medications from the side. We really need to know what his baseline is.
Thank goodness he's surviving that, though, because that's very scary. So
Yeah.
What is the average age of your patients?
They're usually in their 80s. I have
Okay.
some in their 70s, and I have one who's 98.
Oh, wow.
Yes, and so they're all over the place.
Okay.
But generally, the average is in the 80s.
So you don't see people who, because I always feel like we've talked about this, you and I separately, is to getting somebody younger,
So
getting to them in their 60s to prevent this kind of thing, that somebody has, God forbid, a heart condition or something at a younger age, to set the stage for them to not do this as they go along, right?
right. I think that people have a problem letting go a lot of times.
Right.
They think that if they let go, it's all downhill from there.
Mm-hmm, mm-hmm.
I think that people are scared of letting people into their homes and into
Right.
a very private part of their lives, which is what medications are you taking, because they are, once I know there are a lot of medications that people don't tell me that, what their conditions are, but by looking at the medications, I suddenly know, oh, well, you have urinary incontinence, or you have depression, or you have, some other form of, you have different things going on from the medications that they didn't want to share with
Right.
everybody. And understandably. So I've taken care of people who have had surgeries, who have not been able to take care of themselves and have needed some help with medication management while they were recovering. But I think that a lot of times, and this is what I tell clients and their families, I'm not here to judge or to anything. I'm here to help make you feel better. And that's it. I come, I do, I go. And if you have any discomforts or any problems, you can always call me. So that's another thing. I give everybody my phone number in the team. The doctors know to call me or text me. And so do the care managers, the family members, the caregivers. Everybody can get me involved when they think that it's time for me to get involved in whatever is going on at the moment. Because the more information that I have, the better picture I have to help. A lot of times, one thing that I wanted to say is that a lot of times clients tell me things like, I don't feel good, or I have this problem or that problem, and I see it as a side effect from other medications. And I say to them, have you told the doctor when you've gone to doctor's appointments that this is happening? And a lot of times they tell me things, and then they get to the doctor and they white coat. Have you heard of white coating?
Yes, sure.
Where they have so much to say to the doctor, but the doctor comes in, they're limited in time. Hi, how are you? What's going on? Do you have any problems? They look at the doctor where they've had a gazillion questions, and they suddenly everything disappears. And they don't know what to say to the doctor, and they don't know, they forget to mention that they've been having these problems. The doctor says, okay, fine. Or they go to the doctors and they say, doc, I'm having lightheadedness or vertigo, can you prescribe something? The doctor doesn't have enough time to really go through all the medications and to go through everything. Okay, you've got vertigo, okay, why don't you take this? And here they have another medication treating another side effect of another medication, and so on and so forth. And nothing is being treated. It's just being taken care of for, just for the time being.
So there's a lot of the over-the-counter, and then I'd imagine those drug commercials are your worst nightmare when people see that and say, oh, I want to take that. But what are the over-the-counter that you find most people are taking? Because I know a lot of over-the-counter used to be prescription and then made its way into the mainstream. I guess that most headache medication used to be prescription. Now it's over-the-counter. Sinus medication used to be prescription. Now it's over-the-counter. So do you see what do you
I see over-the-counters a lot, but what I see even more are herbals and supplements.
Okay.
And herbals and supplements can be very dangerous and very harmful depending on what the medications are, the prescribed medications are. I'm sorry, my daughter just walked in. Over-the-counter medications can be very harmful. And so what we do is we go through and figure out what the effects are of these herbals and supplements, because most people don't know that herbal medications and supplements are not regulated by the FDA. And they think that if they are sold over the counter, or if they're sold in different supplement stores, that they're safe. And they don't understand that they're not safe. And just because it says natural doesn't mean that it's safe. Just because it's being sold, it doesn't mean that they're safe.
How are they even getting those over-the-counter and herbal supplements? I mean, it seems to me that someone at that stage or having that much medication would be difficult to obtain that unless they're buying it online or.
They can buy it online.
Okay.
They can go, they have caregivers, they have family members. They can say, oh, I've got a cold. Can I get some echinacea? Oh, I have some, some memory impairment. Can you get me some ginkgo? Can you get me this? Can you get me that? I need some to boost my immunity. Get me some zinc. Get me this. They get all kinds of stuff, but they truly don't know the effects of these medications. So yeah,
Yeah.
I'm
So
definitely anti.
what is the overall compliance once I'd imagine the first appointment's the worst, and then you make your way through. So how compliant do you find your patients are once they're set up?
Once they're set up, they're extremely compliant because I make sure that they really, really
Yeah.
are. I see what they've taken and what they haven't taken because I divide them up and I see the empty boxes or the boxes that should be empty and they're not.
Right.
I
Okay.
time things. We always decide when my next time coming is based on how long I've divided the medications for. I order medications from the pharmacy for clients so they don't have to deal with it themselves. I speak with the doctors and the pharmacists. I make sure that it's all it's my hands on deck. They don't need to worry about it. They have the peace of mind that they're always going to have medications. They're always going to be replenished. They know when I come just so that I can see them and talk to them and make sure that they're okay, but they don't have to stay with me at all, when I'm doing the medications. Once I get a routine, I know exactly what I'm doing, and then I just check in with them. How are you doing? Anything different? Have you had any funny things going on this month or whatever it is? And then they can let me be with my work. Um, but I'll tell you, a lot of I every visit is good for me because
Okay.
I enjoy talking to people, and I enjoy seeing them and figuring out what their needs are. And initially, I have a client who, for example, when I started with her, she was on 55 pills a day.
Oh my goodness.
55 pills a day. And she was in terrible shape. She couldn't live by herself. She
Right.
had caregivers who needed to take care of everything for her. She was feeling horrible. She could barely walk. She was shaky. She was just in terrible shape. And now I've been with her for a couple of years now, but now she's living on her own. She's independent. She's able to finally work again. She's
Wow.
able to, yes, focus. She used to write, and she was never able. Since she got sick, she wasn't able to write, and now she's back to writing, and she's
Okay, good.
she's back to being able to shop for herself and cook for herself and take care of herself with no help from anybody else. um,
I know this is a loaded question. What can
my
we do?
favorites.
Yeah, what can we do as a society to help keep people better informed? I mean, one thing is that in my ignorance, thought there was a national registry of drugs. I thought if I went into, uh, I usually use CVS, but if I went into a Walgreens or a Rite Aid and I tried to get my prescription doubled or tripled, there'd be a red flag going.
It depends on what medications are. So
Okay.
for certain classes of medications that are addictive, and they do have it's not so much that the pharmacies have it; it's that the doctors, the doctors should know, but it doesn't always happen.
Okay.
It really just doesn't always happen. There are too many prescribing doctors for each client. A lot of times clients have a cardiologist, a urologist, general practitioner, podiatrist,
Right.
whatever they have, and all of these people can prescribe medications.
Right.
And I find a lot of doubles, and that is and it gets people loopy. It
And
does. I mean,
I
people are
mean, the most
loopy.
amazing thing to me is people who share medication or call their cousin and say, "Can you bring some of your painkillers over?" It's stunning to me that the degree to which
or
that goes on.
or people who are frequent flyers in doctors' offices or hospitals who have a lot of surgeries or procedures, and every time they go there they get more more medication, pain medications, with some, addictive properties, and they end up collecting all of these. And I find, drawers full of, Norco, or, like different,
Oh, yeah.
different, different medications that are, not, shouldn't be there.
Right, right. It's just such a big,
Or Tylenol with codeine and things like that, which people are, that's a big one. Tylenol with codeine, where people are taking, they're being prescribed those following surgeries for pain, and they're just collecting them.
So the lesson learned here is, first of all, Hadas, what you do is a godsend. My goodness, what an amazing. But the other question I didn't think about earlier is, is this covered by insurance?
No,
No.
unfortunately,
Okay.
it's not.
Okay.
Medicare hasn't reached the place yet where they can do this, just as a preventative, a preventative service, although it would save them millions and millions of dollars, because as preventative measures, people wouldn't have as many visits to doctors, to hospitals, emergency rooms, and the like. They wouldn't need as much rehab, and they wouldn't need as much care following disasters, falls and hip fractures and things like that, because of medication mismanagement. But they haven't gotten there yet.
Well, let's hope that as a society, we'll move forward, closer in that direction. So, lesson here is that look out for your family and friends when you see things that don't seem right. Is I think one thing to do is to bring this awareness to families and to people. How do we if we see a family member who's struggling, to ask, what medications are you on?
Right. And also, not only what medications, anything that you take, anytime you take a new medication, you should be reducing another medication.
Okay.
If you're taking more medications, your body shouldn't take a ton of medications. All the supplements and herbals and vitamins are a huge industry. People are taking multivitamins, plus they're supplementing with vitamin D and vitamin C and vitamin E, all these vitamins. It's not necessary. It causes liver damage.
Okay.
Because your body can't process all of these extras. So anytime they're taking medications, run it by a doctor, run it by somebody who knows, and also to see if drugs are safe and have been approved by FDA and things like that. There's a government website that they can look at for supplements, and that's medlineplus.gov, medlineplus.gov, and that is a website that people can see if there have been any complaints or any problems, because they're not regulated by the FDA. You can check with the government if there have been any complaints or problems.
Hadas, what an enlightening hour we've had here, and I thank you so much. So to get in touch with Hadas, you can go to her website, which is www.meddivide.com, meddivide.com, and she can help you do. We're based in California, but you do some telemed and consultations over the phone. So Hadas, thank you very much.
Thank you so much, Patricia. It was lovely being on your show.
Thank you very much. Okay. You have a wonderful day.